Please forgive the shaking hands and the many note cards I'll be reading from. My name is Lexi Timmons. I'm an oncology nurse and daughter of a breast cancer survivor. And today I want to tell you about what I've learned about humor in cancer. First, a little bit of background about me. I'm 27 years old. I was born and raised here in California. Visalia, California is where I was born. And my mom was diagnosed with triple-negative breast cancer in 2012. She went through chemo, radiation, mastectomy, ended up having another type of breast cancer about 6 months afterwards. She's now cancer-free and doing well, but as many of you know, the journey never ends. You know, you're always waiting for the other shoe to fall. So something really important is humor. And so how many of you guys know someone with cancer? Okay. How many of you either have or have had cancer? Okay. And it's not a very funny topic, is it? So how do you make someone laugh, or how do you make yourself laugh when you have cancer or when you're trying to cheer somebody up? I noticed something really surprising as an oncology nurse. A lot of the patients with the worst prognosis would be the most optimistic, the most happy. One of them in particular defined playful. Now this is a woman who I admire greatly. She had advanced breast cancer, and every time she'd come in for her treatments every 2 weeks, she'd be cracking jokes, and she'd have some kind of prop with her every week, whether it was a stuffed animal or whatever. But her first chemo, she had 2 giant-size boxing gloves. I mean, they covered her face. I mean, they were the size of her torso. She'd come in like this, laughing. She would do anything to get a laugh out of us nurses. And the last thing she wanted was for anyone to feel sorry for her. She wanted to laugh. She wanted to feel strong and normal, not sick. So, someone else who really inspired me was a young man with terminal cancer. This guy never talked about his diagnosis. You would see him on the street, you would think he never had anything to do with cancer. The only time he talked about his diagnosis and the symptoms that he was having in his treatment was when he had to. At the very beginning of the treatment, when he came in for chemo, you'd have to ask him about his symptoms and how everything was going. But after that, he was talking about the comedy show tickets that he just got, and the concerts, and all the cool stuff that he was doing. And this guy had the events lined up in LA coming up for the whole month. And so at first, when I saw this in some of my patients, I thought it was like a form of denial or something. Why are they so positive? And then as I started to look closely, it was a form of hope, I think. It was no matter what science or statistics say, they were going to believe in themselves because they knew that they were not the disease. They were happy, and they wanted to be happy. So, of course, not all cancer patients are like this. The road can be really rough, and sometimes you're weak, you're sad, you're depressed, you're tearful. And so if you know someone with cancer, or if you have cancer, first, after you get them to talk and vent and really open up about what's going on, or if you're really opening up with yourself about what's going on, make them laugh or laugh yourself. Do something to make yourself laugh. Okay. So, my favorite cancer patient is my mom. This is her being playful with her sister on a no cancer day. When she was feeling really down and when the side effects had subsided from chemo, she would tell people, "Today I don't have cancer." And she would go and be playful and do things like this, go out for walks in the country. And if you would ask her, "Hey, how's your peripheral neuropathy?" Or, "I'm sorry, today I don't have cancer." You have the wrong person. And she'd be cracking jokes, and the word cancer was not allowed that day. She just wanted to have fun. And I think it really helped in her experience. So, I'm sure you guys have heard laughter is the best medicine. But science actually shows that it helps release built-up trapped emotions and tension. So when something triggers amusement, the brain actually releases endorphins, sends signals to downregulate stress hormones like cortisol and epinephrine, and dilate the blood vessels, lowering your blood pressure. So it's not just fun and easy to do and makes you feel good, but there's science behind it that it actually helps your body. So, what's so funny? Kate Matthews is a cancer survivor and a cartoonist, and she found her healing through cartoons. And when asked what's so funny, she would say, not one damn thing. But whenever I need to feel lifted away from the fear and horror of breast cancer, I turn to humor. And she claims that drawing and bringing out her humor through her art was one of the things that helped her the most through her therapy. And this is a couple more of her drawings here. I don't know, can everybody read that? There's a few left. So research for the healing power of laughter is drawing more attention. So much so that the Cancer Treatment Centers of America has laugh groups, or laugh therapy, first introduced by Catherine Puckett, who's the director of Mind Body Medicine. Laughter clubs are leader-led groups that take patients through laughter-related exercises and have been very successful in making patients feel better. Less use in pain meds, less anxiety, fewer reported symptoms. I don't know if you guys have ever heard of Tig Notaro. She's a stand-up comedian, and I believe she really understands humor and healing. In 2012, she seemed to take her diagnosis in stride of her bilateral breast cancer when she agreed to continue her set in Los Angeles a couple days after she had been diagnosed. But she honestly shared her fears with the audience, and they roared with laughter. They loved her. And I encourage you guys to check her out. Tig Notaro is a great comedian. She talks about her cancer a lot and how it helped her being humorous, being funny. But what if you're not a comedian and you're not used to making yourself laugh about something so serious, or helping someone else laugh about something so serious? You can go to comedy shows. Okay, so you live out in the middle of nowhere and you can't afford tickets. You can go to iTunes and get comedy shows for cheap, or YouTube and get them for free. Great stuff out there. And funny movies. Whether you're into British humor or slapstick, just the point is to make yourself laugh. You know, have fun. You can act like a kid, put your whoopee cushion to use under some unsuspecting person. Or have a pillow fight, or play with a pet, watch funny videos on YouTube. Okay. One last thing, if you know someone with cancer, especially someone you're close to, please go the extra mile to show you care. There's nothing like, when you're a cancer patient, you don't always want to ask for help. You want to know that your friends and family will be there for you no matter what, if you ask for it or not. And if your friend or family member has cancer and they say, oh, no, I'm fine, keep asking. And above all, like I mentioned earlier, laughter is important, so make them laugh. Take them somewhere, take them to a comedy show, whatever, make them laugh. This is actually why I created my company, LumpyCards.com. It was originally inspired by my mom when I was trying to search for things to make her happy when she had cancer twice. I couldn't find it. I was looking for greeting cards, for gifts, anything to make her smile, and it just wasn't out there. So I started creating my own cards for her with some of the jokes that my cancer patients had said, or some stuff I would hear, or some jokes that she would say. A lot of them were a little profane, so I won't repeat them here, but you can see them at my booth later. And I started showing them to my patients, and they loved them. I'm like, oh, okay, I can do something with this. So I started a company, and now I have over 50 cards, and I have apparel and mugs and dog sweaters coming soon, so it's growing. And here are just a couple of them. I left the profane ones out, so you guys are going to have to go see those in the booth. Big or small, save them all. This one's blank on the inside. I don't know if you guys can read this really well. It's kind of like from a spouse to another spouse. When I said in sickness and in health, in the inside it says, I meant it. I'm going to be there through everything. And these are just a couple of the cards. They're available in 10 packs and stuff. So these are some of the shirts. I did put one profane in there.
What does it say?
It says, no time to cry, I'm kicking cancer's ass. And this one is a couple hoodies. This little hoodie says, bring it on. It's a little cat. And the one next to it is a dog peeing on the word cancer. That one's my bestseller. Believe it or not, all the profane cards are the most popular cards. Get a little aggression out when you're giving a gift. So, any questions? No questions? Okay. Thank you. I'll be at booth 86.
I just came from the guru's website. I'm still washing off